It's now my pleasure to invite Ian Culbert, who is the Executive Director of the Canadian Public Health Association, and he has had a 25-year career with the association. He has held a number of positions, including Director of Communication and Business Development and Director of the Canadian HIV, AIDS, and Hepatitis Information Centers. Ian Culbert has expertise in a number of different areas, including health promotion, knowledge translation, social marketing. Most recently, he has led a team effort to strengthen and expand the association advocacy for the adoption of evidence-informed policy alternatives. Welcome, Ian.
Thank you very much, and thank you to the organizers of today's event for the invitation to participate. I'll start with a couple of disclaimers. The first, I'm not an academic or a researcher or a scientist, but I work with a lot of them, and so I gain from their intelligence. So my second disclaimer is that the ideas I present today are not my own. And no, I'm not pulling a Wenty. I'm not admitting to plagiarism, but rather acknowledging that the Canadian Public Health Association relies on a wide range of extremely talented and intelligent member volunteers who generously give their time and talent to the association's advocacy work. Any genius I share with you today is completely theirs. Any errors I make are completely my own. So in July 2010, when the previous federal government decided to replace the mandatory long-form census with a voluntary survey, the Canadian Public Health Association, along with hundreds, and literally hundreds of other non-governmental organizations, trade unions, faith-based organizations, academics, business people, and average Canadians expressed our concern, perhaps our outrage, that the government of Canada would unilaterally eliminate one of the most effective tools for measuring our progress or lack of progress as a country on a number of different indicators. Now, all of these different groups had their specific reasons for being outraged, as did the public health community. We enumerated ours in a paper we presented to a House of Commons Standing Committee in November 2010. And while it was clearly a lost cause trying to change the Harper government's position, it's interesting to look back as part of today's event to see if our concerns proved accurate or not. The association listed 4 significant causes for concern resulting from the elimination of the mandatory census. First, the loss of data accuracy, which I'm also going to touch on lightly because the next presenter is going to do a better job of it than I think. Increased costs, which we've already heard about, so that'll be short as well. But then weakened accountability in decision-making and the negative impact on health research. So clearly, we know the numbers are there. Less people completed the voluntary survey. But even more troubling, however, is that, as we predicted, it was the most vulnerable in our society who were less likely to respond. The poor, marginalized, and immigrant communities tend not to participate in voluntary surveys because of barriers such as language, literacy, and disability, while First Nations, Métis, and Inuit communities are already underrepresented even in our census data. And what we found is that the mandatory voluntary NHS made the situation worse. Because of all this, Stats Can was forced to lower its standards, and the point at which neighborhood results were suppressed due to a high non-response rate was 50% in 2011, compared to a cutoff rate of only 25% in 2006. And that's a huge difference. That means that if the 2011 survey had been held to the same standards as in 2006, more than 2/3 of the country's approximately 5,000 neighborhoods would have been excluded because the data was just too unreliable. So clearly, we lost data accuracy, and it cost us more to get it. StatsCan knew the response rate would be lower, so the NHS was sent out to approximately 4.5 million Canadian households, representing a 13% increase in distribution compared to the 2006 long-form census. Now, they had estimated that the cost associated with implementing the NHS would be about $630 million, and while the previous census cost $567. And according to StatsCan's own figures, the actual cost for the NHS was about $652 million. So if you adjust for inflation, the NHS cost $29 million more and for much poorer data. But the greater and more egregious cost in Canada was the loss of 35 years of investments in continuous, standardized, and accurate data. By breaking the pattern, we lost, thankfully temporarily, the ability to accurately compare data over time and the ability to analyze trends. Now, while we'll always have the 2011 blip in our data, the decision to restore the long-form mandatory census means that statisticians and decision makers will be able to accurately track important long-term socioeconomic trends. The loss of data accuracy resulting from the low response rate is directly linked to our third concern, that the implementation of the NHS would lead to weakened accountability in decision-making. As I mentioned earlier, the data from hundreds of neighborhoods had to be suppressed because of the low response rate. As a result, data analysis had to be done at a higher geographic level, but this higher level analysis is unusable at the local level. In most municipalities, census data has been instrumental over the past decades to target resources through place-based policies and programs. Without this detailed information, there's an inability to accurately track and evaluate important long-term socioeconomic and health trends. This lack of place-based data negatively affects the capacity of decision makers to make evidence-informed decisions when they're prone to make evidence-informed decisions on policies and programs, and as a result, we waste money and effort. To be truly effective, governments need to target their interventions and resources where they are needed most. A mandatory long-form census provides governments at all levels with the ability to assess where poverty and other disparities exist, and more importantly, to determine if policies and programs are having an impact, and then the nature and degree of that impact. Finally, back in 2010, we also felt that the voluntary NHS would have a negative impact on health research. The very high response rate to the mandatory census in previous years provided unrivaled accuracy and allowed many other key sources of data produced by StatsCan to be benchmarked and to be drawn from appropriately weighted samples. Although public health practitioners and researchers frequently use data generated and collected through voluntary surveys, the representativeness, yeah, I got it right, of the responses is usually checked against the census data. The absence of reliable census data is thus not just a deficiency within itself, but affects many other data gathering activities. As I mentioned before, the change in methodology has affected comparability over time. If the voluntary NHS had continued, data users would not be able to compare any values due to the discontinuity between earlier and later data. The mandatory long-form census model provides a critical foundation for the generation of data from other health surveys as well. One example is the intersection between the long-form census model and the Canadian Community Health Survey, a very important public health decision-making tool. This essential database for the country's public health units and medical officers of health is used for the planning and assessment of policies and programs in their regions. The CCHS bases its sampling and methodology on census data. The information gathered and made available through the long-form census is essential to understanding the health of our communities. This understanding allows those communities to design and target programs and policies that improve the health and well-being of Canadians, particularly the health and well-being of the most vulnerable and at-risk populations. A place-based approach to service coordination and investment requires accurate neighborhood-level data profiles to accurately plan strategic approaches to community development and to inform service provision and neighborhood investment priorities going forward. Long-form census data enables the public health community to assess the efficacy of public health programs, measuring whether health outcomes in particular areas are better, worse, or the same in the wake of an investment or an intervention. Census data also helps to provide challenged populations and assists in setting priorities to reduce health inequities. Without reliable census data, we would not have an accurate idea of where the pockets of poverty and other disparities are, and whether the policy changes being made are having an impact. Long-form census data also enable public health workers to anticipate places and populations that might be especially high risk during a public health emergency. For example, a neighborhood with a high concentration of two-bedroom apartments populated by families composed of 6, 8, or 10 people is a very important place to situate a vaccination clinic in the event of an H1N1 type outbreak. Now, these are only a few examples of why public health researchers and practitioners celebrated the return of the mandatory long-form census. If something is important to you, for example, the conditions that create health for Canadians, then you need to measure it. For example, let's just say a couple of provincial governments, and for the sake of argument, maybe even the federal government, want to have a serious discussion about a basic income guarantee. Then the data that will be collected in the 2006 long-form census will be crucial in determining where the need is greatest. Similarly, if governments in Canada want to get serious about supporting young families through a pan-Canadian early childhood education care strategy, then they need the data from the long-form census to know which neighborhoods need more daycare spots. And the same census data would support governments in planning and implementing an effective affordable housing strategy. So right there, you have the pillars for a pan-Canadian poverty reduction strategy, all based on the data from the long-form census. And then future long-form census data will illustrate the positive impact of such transformative social programs. I guess my time is up. It's okay. One sentence, it's something to think about, and definitely something worth celebrating. Thank you.